be the virus is overheating your entire body. That's killing off cells that are not that otherwise have no ball play into this real quick.
And I want to interject real quick. You know, I got stunned a little bit. You know, I've been doing my nursing,
right.
school.
Mm-hmm.
You brought up a good point. How your body, how your in your body's immune response to COVID, it produces something called a cytokine storm.
Yes.
Where your body is literally
just
trying to fight
everything. Yes.
Anything that's like that's a pathogen that's in your through your what is it? What term? What is it? That is through your tract, your airways, your lungs, essentially.
Basically, your respiratory system.
Yeah, and I think that's the part that people are kind of overlooking. It's like your body is literally turning on itself.
Exactly. And that's the issue. That's why we have to be careful on how we define certain viruses, because we jumped with the HIV viruses, which attack your actual immune system, while this virus is actually just is making your immune system go into overdrive. So we have to be very careful on how we talk about viruses and what their meanings are. And we must understand how much we don't know when it comes to the immune system, as laymen's, on how it works. Because right now, one of the biggest things with COVID is how long does the antibody stay in your system?
Let me ask y'all this. Gee, what is an antibody?
It's a white blood cell.
What's an antibody?
Antibody.
That's a short question. Short answer.
Oh, no.
Well, antibodies are produced by the white blood cells, right. But they are when it comes to cells, they have receptors. Antibodies basically have the right key code, which is called a receptor, that are able to either destroy or overrun a particular virus because they have the key to get into that virus.
Right.
All right. Let me ask a question, because this seems like to be this seems to be the crux of this whole argument, right? That most people think that the coronavirus does this, right? All this news that we're getting or information is based off of what they tell us, right? But we know from like confirmed scientific research what viruses are. Mm-hmm. Like without even investigating SARS-2, coronavirus, just looking at what we've known for the last 60 years what a virus is, right? Viruses need a host. I just named 3 possible transmissions, and like how people like contract them, right? It's not, I think it's being exacerbated, but
now by exacerbated, are you saying like
blown up? If
it's exaggerated.
If I told you if you walk down a certain street at 9 o'clock, that because one person has been shot and robbed, that you'll get shot and robbed.
Okay.
Right? Maybe you won't.
It's hysterical.
Maybe you walk down the street and you could get injured in other ways, right? Not necessarily being shot. Get hit by a car or fall off the curb or whatever, right? So, but you telling if you walk down that street, you'll get shot, right? Like, so somebody will think that, like, damn, that street right there, I'm gonna get shot. When you've probably had 20 people that have been injured, right? Walking down the street after dark on the weekends, probably drunk, intoxicated, got hit by a car, right? Fist fight, all types of like random shit. But everybody's been told if you go down the street, you're gonna get shot. Lord forbid robbed, but you're gonna get shot, right? So that's exacerbating the danger that's on that street, right? They're using that as an example, but just using common sense, right? And some conspiracy theories, right? But the conspiracy theories, literally, I can pose questions as opposed to scenarios, right? Using the conspiracy theory first. If the government is transmitting or transferring information to the media, and the media is then telling you about COVID-19, let me see if I get this straight. The same government is not preventing preventable deaths by officers on black, brown, and even white people in America. Something that they can stop. But they'll tell you that it's a life-threatening virus out there that can kill you, and we're trying to save you from contracting something and killing other people. Logically, just using conspiracy theories, right? Why would they do that? You're not even trying to stop police from killing people that don't have weapons, but you're going to prevent me from contracting a life-threatening virus. Think about that. Like, seriously, that's like putting the cart before the horse. If you're going to save my life, wouldn't you start at the basic level? Law enforcement, pass laws, bills, legislation to keep them from killing you, unarmed, unauthorized, right? Like, you wouldn't have a whole police brutality uprising, right? because that would be curtailed, right? But fuck that. Kill all the people. You could die from a cop, right? The same people that we control through state and federal government taxes, right? And kill you all day long. But we gonna try to prevent this virus from getting to the black people, from getting to the white people, Asian, and or other sector of America. Like we're gonna prevent that from killing some shit that's like in the air, according to media, that you can breathe in, that you can't stop, and viruses can't be killed, and viruses take vaccination. It takes 3 to 5 years to even come up with a vaccination. And even HIV's been running what 40 years? Ain't got no cure for that. So something that we can't stop through nature and osmosis, but something that we can literally physically stop. We can stop police officers from shooting you. Like, why would they do one thing and not do the other when the other thing is the easy shit?
I think
That's something to say about that?
yeah. I think we can walk and chew gum at the same time. I think it's a false equivalency to say police brutality and public health or vaccinations are synonymous because it's true. Yes, they can stop the police brutality through procedures, through policies, through laws and things like that. But there's no law about about diseases.
Well, actually there is.
Well, what I mean by how to, for example,
wait, hold on, expound on that.
Okay, there's a law on how
there's a law
to cure
in New York.
disease.
They was giving people in tickets for $800. That's
For what?
not me. That's real. Before during what was it? April, May, June, and July, they was giving black people tickets, fines, and arresting them for being outside without face masks.
But is that
which law is that?
I don't know what the name of the law is.
Is it a
but
statute? Is it a law? Because that means it has to go through a process to become a law.
My point is, it still was an ordinance that Cumio actually passed, right? Or
So you're saying that you're against public health?
No, I'm against the mandate of public health. I think everything in a democracy, a democratic republic, is a choice. Which separates us from communist China, and it separates us from totalitarian Middle East.
But in our democracy, we have the right to life, liberty, and the pursuit of happiness. And that actually, your rights end where my rights also start, correct?
No.
So when it comes to public health, your rights end inside the public because publicly, I have a right to be healthy, life, liberty, and the pursuit of happiness.
Okay. You also have the option to stay in the house, which I think that the government should have actually done that. Not close down businesses, not lock down anything.
But wasn't the quarantine equivalent to staying
Well, this is the thing. You quarantine people that want to be quarantined in a democracy. Unlike communist Russia, where you can't do that, right? It's supposed to be the land of the free, home to brave.
Right, in theory, yeah.
Which means we don't want it, so the people say we don't want it, so the people do not allow it, right? So you say, like in North Carolina, they didn't close down shit. Not churches, not businesses, not banks, not nothing. Parts of Michigan, they went out and protested to where even the governor actually said, all right, certain things we gonna open up them hair salons. We gonna open up the spas, right?
Right.
Like, because they put up an uproar. Most democratic states, or like Georgia, and it's a
we're definitely not Democrat.
cities. My bad.
Okay.
A lot of democratic cities, like parts of New Jersey, parts of New York, liberal Seattle, Oregon, California, they were actually passing ordinance and basically mandated laws, right? Temporary laws, right? Because they had extensions where once they expired, they had to uplift them, right? The people actually sat back and let the government control them and say, actually, I take that back. The public actually sat back and waited for the government to come up with solutions and comply with what they order, right? In a democracy, you do not do that. You do like what North Carolina does. I'm sorry, a lot of black people and white people are just not understanding what your Constitution constitutes. Even at the detriment of your health, you have freedom. Meaning that the people that want to be quarantined or wear face masks or stay away from the public, stay fucking in the house. Order stuff online, like you've been doing. The people that want to go out, that don't think that this is as big as it is, do not mind us dying.
So what happens when you become an essential worker and they make you work around people who actually has a disease and things like that? Because that's what I was for a few months.
Oh, you mean like when you mean Denise?
I'm an essential worker.
What kind of worker?
An essential worker.
Well, I mean, what industry?
I was in telecom.
What is that?
Basically, the first conspiracy about COVID, which is 5G,
5G?
is being thrown through the air.
You got to do the Q&A. That's why I'm asking questions, because I don't know. Like, what did you actually do that you said they made you?
Yes, exactly. Because, okay, let's remember, we are not in just a democracy. We're in a capitalistic democracy. That means that we have to have capital to survive. Meaning we need money, a flow of money, so that we can actually survive. We can't just stay home and we can't do certain things because everything is interconnected dealing with money. So with that being said, for an essential worker like myself, which I didn't believe I was an essential worker, but my company made sure that they were on the list of essential workers. Because they said from a telecom point of view, you need public safety over the airwaves, the RF airwaves. So if you want to have a police call or a fireman call, you need to make sure that the telecom infrastructure is in place so that those calls can go through. Not to mention, we're going to talk about the other essential workers, such as your frontline grocery store clerks. A grocery store, you need to eat.
Many of which died from COVID.
So right now, 25% I believe all death are black people.
Hold on, you arguing my point, but continue.
The point? No, my point.
I'm like, you always use a man's argument against him.
Oh, okay.
I guess the point I'm making here is saying that we're saying in our democracy that you can just stay home and you don't have to go out to the public. But then our same democracy says that you need money so that you can survive. And the same democracy says that we're not going to give you money so that you can survive if you want to stay home. Therefore,
that would be socialism.
Yeah, it'd be good socialism. So I believe that when we say that, once again, I want to make sure I'm clear. Your rights end where my rights begin. You cannot, just like when it comes to Roe versus Wade, people are saying, hey, you cannot tell a woman what to do with her body. It's her body.
You kind of can, but continue.
I guess.
Okay.
If you knew the backstory of Roe versus Wade, Jane Roe, you would actually be able to tell women. Like that whole, when people use that, that's a flawed example.
Who is they? Men or women? Who gets to tell somebody what to do with their body? Who has that? I have the person.
Where did you hear it from? Was it media?
Okay, I'm like, this is what people have women have the problem with. I had a woman tell me, and we're going off the beat.
No, go ahead. Listen, we go
with
with
this as a sidebar, an anecdotal story. I had a woman tell me, she said, you can't tell me, well, you're a man, you can't tell me what to do with my body. They kind of can, and they kind of have. All they have to do is just close down. Now, you can get an abortion. We just won't facilitate it. You can get an abortion. Insurance won't cover it because it's cosmetic surgery. You can get an abortion, but we just won't help you. So good luck with that coat hanger. Now, the argument...
but isn't that freedom? Isn't that freedom?
No. You can do an abortion.
Yes, freedom.
However method you feel.
Exactly.
But what you can't do is use our governmental facilities. Now, I don't believe they should shut down private gynecological, however you say it.
Gotcha.
I don't think they should shut down private facilities. Like, if I'm a gynecologist and I say, yo, I want to do abortions, mammograms, blah, blah, blah. I should be able to do that in charge, but that should be private insurance, not covered by Medicaid, and what else? It shouldn't be state facilitated by my taxes or your taxes, right? Because I don't agree to that. Now, when he says, with the right to people's body, so, yes, we do live in a democracy. This is going back to the original point.
Do we really?
We do, well, allegedly.
Feels like an oligarchy.
It is, but let's go off of what we know from 1998, right?
Okay.
So, since we live in a democracy, or a democratic republic, but it runs off of capitalism.
Right.
And people need money. That's why it was a twofold thing. Well, your government allocated funds through PPEs, unemployment stimulus and stuff. So if you chose not to go to work, or your job said, well, even though you are essential, do you want to work, or should we let you off so that you get unemployment? You would have been made whole, or some would have, right? You would have got that. You at the crib, you chilling, you away from the people, you buying into the hysteria. You is believing the paranoia, right? From a virus that has a 94% recovery rate and has a 0.01 or 0.1 mortality rate, right? It kills.
I don't know
that's
about
not true
that.
at all. Yeah, it definitely has a 3%, about a 3% mortality rate.
Look at the population.
We can just use the population. That's
what's
10%?
What's 10% of 327 million?
Those three. Okay, first and foremost, we have to talk about how many people already has the virus. Let's go about how many people have been tested with the virus, which is what?
What virus people?
Which is 3 million, right? Or 4 million.
People. It's actually 7.
Okay, 7 million.
According to
You
the
7 million. That's fine. 7 million.
Okay.
What's 10% of 7 million?
No.
700,000.
What's half of 700,000?
350,000.
Where we at? 200,000. I mean, we're about 3%.
Maybe 214.
We at 250. That's 3% of the cases are dead. That's literally 3%. You said use some numbers.
I'm not gonna go over cases of people that's been hospitalized.
So what are we gonna go with?
And I'm gonna use people that's dead. Fuck the people that's in the hospital, because you can get healthy. You ain't the deciding factor is if you die. You ain't dead yet. People get sick every day, B, and that's not even being sensitive. That's just being realistic. That's just being realistic. Diana Ross had the walking pneumonia for 11 years, according to a story she told.
Okay.
For a decade, she had walking pneumonia, which I don't know what that is. But she was sick, but she was bedridden, and most of the time she could walk, she could perform. Right? People get sick every day. Right. I'm tired of people trying to. It's for your safety. I told a dude, nigga, I've been sick before. Thank you, but no thank you for trying to keep me healthy. I smoke cigarettes and I drink. I don't need your help. I really don't. I don't need the government. I don't need my common man to keep me healthy and not sick. My nigga, I have bronchitis. So I smoke cigarettes when I'm not posted.
Which would make you more prone for COVID, right?
No.
Bronchitis is not an underlying health issue?
No, I got, it's acute. It comes and goes. It's not chronic.
Okay.
Even with that being said, I ain't supposed to smoke no cigarettes. I smoke cigarettes, cigars, and drink alcohol, carcinogenics that depreciate the immune system. Yet I haven't had the flu in over 20 years. I know people that don't smoke cigarettes and don't drink, and niggas be sick 3 times a year. I haven't had the flu since I was 12. So,
Okay,
and let me interject real quick. I think I don't know how credible you think Dr. Fauci is. I'm sure you probably don't think he's credible.
now when you sit on the board of Bill Gates and Melinda's foundation, no.
Okay, hold that thought.
Highly
Hold
incredible.
that thought. One of the things that I think is very unique about COVID is there's a whole spectrum of immunal responses. Mm-hmm. The way your body may respond to it,
right.
You may beat that shit like it ain't shit. I might get that shit, and I'm a goner.
But that's why I said public health.
Well, that's not even
science.
true.
That's very true.
It is true. Public, like I said,